Thank you so much for coming to the Mental Health Provider Forum by HFA. We're really excited to have everyone here. And before we really kick anything off, I just want to mention that this webinar is being recorded and we will offer it online within the next couple of weeks in case you would like to rewatch the recording or share it with anyone. We know that mental health has been a concern, especially during this pandemic, and our hope is that this panel will provide you with some resources and help make connections with the community. It's really intended to be an introductory, to offer introductory information on each of the topics. Before we really kick off, I do want to be sure to thank our sponsors, without whom we would not be able to provide the webinar. And especially I would like to thank Sanofi Genzyme and Takeda for their support of HFA programming. In addition, I want to point out that this webinar is really just educational. If you are having concerns about mental health, there are resources on the HFA website. And of course, if you're experiencing some sort of mental health crisis, we encourage you to call 911. So my name is Heather Keese. I am the Associate Director of Programs at HFA. I will be your moderator today. Before we really kick it off, I just want to review the structure quickly. Each of our 4 panelists are mental health experts and frequent speakers on behalf of HFA. We have asked them here today in order to share this feedback on particular topics. And the topics that we selected were identified after a lot of conversation with community member and member organizations about what they think the most prevalent topics are currently. Right now, everyone is in mute, but if you have any questions, you can either raise your hand or put it into the chat. Carrie Koenig, who is the Director of Programs at HFA, is monitoring the chat and will be sharing those questions with us at the end. So the first person who we've asked to speak here today is John Mclean. Gary is going to speak about isolation and loneliness. So take it away, Gary. Thank you.
Great, thank you. Thanks for the opportunity to be here, and nice to work with you again, all of you at HFA. And Heather, thanks for your great organizational skills here. It's really made me feel very relaxed about this. So thanks, Heather, also. Again, nice to be here, and this is such an important topic. This is, we're dealing with a lot of isolation right now. So I'm going to talk a little bit about isolation and then give you some quick ideas about the way that I'm working with my clients right now, beginning with the absolute promise that I will keep to my 5 minutes as well, just so you know. I kind of have some notes prepared to make sure I covered things I really wanted to talk about. What I find is that my focus is on chronic conditions with the clients that I work with, and I often have conversations about loneliness and isolation. In the best of times, I'm having these conversations. I think kids feel especially they feel differently able. They feel limitations that they have to live with. They often feel isolated at school, isolated from other kids because they maybe have to have certain restrictions. They may be treated differently. There's a lot of bullying, I think, that happens with kids with chronic conditions, and again, contributes to isolation. I think adults have similar experiences, accommodations at work, absenteeism, feeling isolated from other employees. Parents often feel isolated, unsupported, and I think especially in communities where there's less support around from the bleeding disorder community, people can be very isolated. Now we're in this pandemic, and in psychology school, the first thing they say the first week is don't isolate the patient. And what have we done? We've isolated the patient, we've isolated ourselves. And I think this has been very, very difficult. And I think for all of us, certainly for me, for all of us, and this, I think, been a double whammy for individuals living with chronic conditions like bleeding disorders. I think we have the technology, the Zoom, but we're reaching a pandemic fatigue stage right now, and I think we're needing to be physically connected with other people. And I think we're allowing ourselves to really feel the frustration of the last years. We see that little tiny light at the end of the tunnel with the vaccines. So my undergraduate social psychology textbook was called The Social Animal, and I love that term. We are social animals. We need to be around other people, and we fire on all five senses. And that the Zoom cookie baking just isn't making it anymore. And it's been, I think, very, very difficult. The sense of isolation leads to loneliness over time. And I might just mention the research has shown that the experience of the risks of loneliness and isolation are similar to smoking and obesity. They affect our health as well. Depression, which I know will be discussed later, is a risk. Anxious thinking, anxiety. So I'll talk about some of the ways that I work with my clients that I try to help. One is I think it's helpful to know that you are not the only person in the world who feels this way. You feel alone, but you are not alone. There are many of us on the planet who feel the same way. Certainly others who share your diagnosis with bleeding disorders, but also in general, you're not alone. I'm a CBT person, so I talk a lot about self-talk. And I think labeling yourself as unlovable, labeling yourself as an outsider, I think contributes to more feelings of loneliness and isolation. So I talk a lot about self-talk and giving yourself some positives and shifting your perspective, reframing. You're alone, but it doesn't mean that you're alone in the world. I talk about that a lot. Giving yourself some encouragement, I think, is really important when you're feeling lonely and isolated. Not labeling yourself as damaged goods, which I find is something that individuals with chronic conditions often say, well, I'm damaged goods. And, I can't connect with other people because of my condition. And if you constantly label yourself, then it becomes a self-fulfilling prophecy. What I tell my clients is you're a multifaceted creature. You're many things. And one little piece of you is your diagnosis, but there are many pieces of you. You're multifaceted, and let's experience all of who you are, and let me help you to do that. Your bleeding disorder doesn't have to define you. It's a piece of you. It doesn't have to define you. I encourage my clients to get out, as they feel comfortable. Certainly during this pandemic, it's been a little bit different, but even if you go out on your own, just to be around other people, not to isolate any more than you have to, and be a joiner. Join, there's so many opportunities online. There's meetup.com, which I call the therapist friend. And there are a lot of ways, just get on Google. There are a lot of ways to get connected. Be a joiner. Join a support group, join a club, join a reading group, join a something, join. But get out and get connected with people. Reach out to somebody else who maybe needs a friend as well. But the point is to take the first step. It takes time, tiptoeing to build a friendship network. But that's what my focus is on. Let's help you get connected and reach out. And of course, always be an advocate for yourself as well. And I end every session with take good care of yourself. And that's really is the message. Thank you. Thank you very much.
Thank you very much, Gary. I appreciate it. The next panelist who will speak is Juliana. Juliana will be speaking about anxiety.
Thank you so much, Heather, and thank you to Carrie and to everyone else for organizing this event. So as you can see, I work primarily with kids, but when you work with kids, you also work with parents. And a lot of the times we're working on issues of anxiety, particularly right now in the pandemic. So since I'm a neuropsychologist, I always take it back to a brain perspective. And what I can say is that anxiety is there because it used to be adaptive. So, back in the, prehistoric times, if a lion were running after you, you needed to have that anxiety part of your brain take over, the fear center. It's called the amygdala, at least lives deep in your brain. And when the amygdala takes over, it does a lot of things. It increases your respiration and increases your heart rate. It shuts down your digestive system, and it gives you a shot of cortisol and adrenaline to get you so you can run as fast as possible. So that is really adaptive when you are running away from a lion. The problem is there's no lion in our culture. It's a bunch of tiny little ghost lions that are around us all the time. So what this has created is this has created more of a chronic stress situation. So I don't know if anybody here during the first week of the pandemic that I was in fight or flight mode. You know, I was mostly in go, 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 go. Okay. And that energy, that release of adrenaline really helped me to reorganize my life the way it needed to be, helped me to clean my house the way it needed to be, get the supplies I needed. But, you know, a year and some change later, we're all in a different situation. And so that chronic stress, having those little hits all the time, the human body is just really not adapted for that. There's supposed to be periods without stress, but many of us are living very stressful lives. And as Gary was saying, we don't have the release of the social isolation right now. In addition, when you have a bleeding disorder, something that needs to be managed on a regular basis, that's a chronic stressor. Sometimes you've got it well under control and that's great, but there's an unpredictability to it. You really never know exactly, you know, it's just another thing you have to factor in all the time. And you never know if there could be something that would happen that would set you back. And certainly, you know, some of the folks in the community who are older adults who lived through the 80s, there's a whole different kind of trauma with the community. So, you know, you have in the case of like health anxiety, when you have you know, a health problem and you're dealing with it and the disease burden of it on a regular basis, the best conceptualization of that we have as psychologists is traumatic stress. So more like PTSD, but kind of PTSD light. And what I mean by that is you end up with some of those symptoms which look a lot like anxiety, but they're traumatic stress. So re-experiencing events are some of those symptoms, avoiding certain things, and being kind of in a state of chronic hyper arousal. That's the difficulty sleeping, difficulty calming down, startling easily. So those are things that happen, traumatic stress symptoms that happen that are pretty typical for either caregivers of people with chronic illness or people who have chronic illness themselves. However, I think we all went through it to some degree, those traumatic stress with the pandemic. The whole world had a traumatic stress event. And there's also a bit of grief that went along with the pandemic. Even if you are privileged and you had no major loss in jobs, you didn't lose family members, obviously all of those things that's going to increase your grief and stress level tremendously. But even so, your way of life has been radically shifted. There are things you have to worry about that you didn't before. And so we have seen a huge, and also the disruption and the isolation that Gary was talking about. So we have seen a huge increase in anxiety disorders based on the surveys that have been done in adults, roughly going from about 13% to 40%. So that is basically a tripling of anxiety disorders among American adults. It is huge. Just, I mean, these are people who qualify, and we're all get a little anxious, a little worried at times. I'm talking about where the anxiety and the worry stops you from being able to do what you need to do on a daily basis, where there's what we call functional impairment. And so that is something that's an incredibly high number. I personally am also seeing it with kids. We don't have the data yet on how many kids, but I would best bet it's up there, if not higher, for the kids as well. We're also seeing a huge rise in drug and alcohol use. And one of the things that, you know, that is something that is often used to cope with anxiety. And alcohol is a very powerful anxiolytic, which means an anxiety reducer. Unfortunately, it reduces a lot of other things in the brain. My professors used to call it one of the dirtiest drugs around, in terms of, yes, it reduces your anxiety, but it also reduces a lot of the functions that you need to cope with the anxiety or whatever the stressful situation is. So I suspect that most American adults are experiencing some form of anxiety and coping with it in some way or another. As we are beginning to open up and there's, you know, a renewed sense of normalcy in some ways, that creates its own anxiety. So basically, you know, when you're trying to navigate, what is this going to look like now? What are things going to look like in 2 or 3 months? You know, humans really do well with a sense of predictability and control. And that is something we have all had to let go. We don't know what things are going to be like in the summer. We don't know what things are going to be like in the fall. It's very hard for us to deal with. And as you return out to start doing things that you're like, whoa, I have not been to a restaurant in a year. If you're one of those people who didn't go to a restaurant in a year, or the kids going back to school where they've been virtual for all this time. And my gosh, you know, they're so excited, but they're finding out that school is not what it was. And it's stressful to be back in that environment, especially if you're a kid with a bleeding disorder and you got to manage that on top of, I mean, it feels like everyone's maxed out just managing school in the pandemic. And then you're like, well, don't forget about me over here. I've got these other things I have to pay attention to as well. So the good news about anxiety is that we do have really good treatments for it. Like Gary, I'm a big fan of cognitive behavioral therapy. The reason I'm a big fan of it is because we have really good data to show that it works. And I'm a big fan of, if you're going to spend time and money on something, that you want to have the efficacy. We want to do efficacious treatments. And what cognitive behavioral therapy does is it actually helps you identify what thoughts in your head are incorrect. Like you have to test, you know, they're called cognitive distortions. So, you know, you become very overwhelmed at the idea of something. Is that worry that you're having about this particular thing that's happening, is that proportional? Is that reasonable? Let's test it. And there are ways to make it fun and cute for kids so that they can understand it. And, you know, my kids love to talk about leapfrogging, you know, meaning that you're jumping ahead, you're jumping to conclusions, you're worrying about things that are 3 or 4 steps away. And is that a helpful thought right now? So CBT is available from, you know, a lot of psychologists provide it. You can probably find a referral from your pediatrician or your school in your area, or from your general practitioner if you're an adult. Medication can be pretty effective too. Medication is a bit more of a mixed bag. Some SSRIs they can help with like chronic levels of stress, and that might be what some people need, but they don't target anxiety directly. The drugs that do target anxiety directly tend to be things that you don't want to take every day, that you just want to take when there is a, you know, when you're feeling a sense of panic, when you're really overwhelmed, then those are the better time to take those kinds of drugs. But those things like Valium is what I'm talking about. Those are not healthy and appropriate to take every day. So you have to figure out some ways to manage your stress and to chase all those ghost lions away and just pay attention to the real lions. And one thing that, you know, CBT helps you to do that. Things that can just lower your general level of reactiveness include exercise, which I think is really important, and mindfulness meditation, which is a great practice to take up to reduce your anxiety. A lot of people say it really changes their life. It helps you focus your thoughts, helps you be more aware of what those thoughts are so you can kind of reality test them. And then I think sleep is incredibly important for the health of your brain. And I mean, I'm working with one kid right now who she is not sleeping and she has received treatment for anxiety and depression, but I don't think that she can get better until she gets better sleep, because the brain just has to heal. You have to have, you know, the chance for those neurotransmitters to reorganize themselves a little bit and make new patterns. And sleep clears out the waste products in our brain. That's the miracle of what it does. And, you know, you have to have that in order to be able to, I think, engage in some meaningful change at a brain level and a thought level. But on the whole, if you're feeling anxiety, boy, you are not alone. I think most of the world is feeling it. And there are really good treatments available that work very well. And so I really encourage anyone who is struggling with it right now that your life can only get better if you seek some treatment for it.
Thank you so much, Juliana. I should mention also that we do have these questions that people have sent ahead of time. So we will be going back and asking those questions. Again, if you have questions, you can put them into the Q&A and hopefully we'll be able to respond at the end. We do have 2 more topics to cover, and the next panelist to speak will be Dave, who is talking about depression.
Great. Thanks, everybody. Greetings from northern Utah, where we have spring one day and winter back the next day. So it's been quite a crazy ride. So I'm going to talk a little bit about depression. And the biggest question people a lot of the time have is, what is depression? When is it depression? When is it not depression? So by definition, depression means that for at least 2 weeks, more than half of the days, you're feeling down, depressed, or hopeless, or you've lost interest in doing things. So that's the basic definition. And so a lot of people, and I would say most people over the last little while have maybe struggled a little bit with some depression. There's also some, adjustment disorders, or when we just are reacting to something big that's going on, and definitely the pandemic was something big going on. But what we want to be looking at is when it starts to become a pattern, when it starts to be stuck in your everyday activities, and it stops you from doing the things you used to like to do, or you just can't get out of that funk. That's when you really want to do something. And I appreciate Juliana and her insights on anxiety, because a lot of times I see anxiety and depression as two sides to the same coin. Anxiety is that tiger running, and depression tends to be just your body just shutting down. It's like, I can't do it anymore. I am done. And so that's where I think a lot of times the strategies that we use for depression also work for anxiety, and vice versa. So one of the things that we haven't mentioned yet, but I think is important, is that my colleagues and I have put out this handout that Heather has sent out to everybody. And I think this handout has some really good things in it. And so I'd encourage you to go back to it. So what I'm going to use my time on, just to talk really quickly through depression, is I practice from a biopsychosocial spiritual model. And I think the thing that can work for both anxiety and depression is, maybe just finding one thing that you can do differently in each of these areas. And Juliana's already talked a little bit about improving your sleep, the potential for antidepressant medication. And the rule of thumb with depression is, for moderate and severe depression, the recommended treatment is combination therapy, medication and psychotherapy. And so if you're struggling just getting drugs, because a lot of times you'll go to your primary care doctor and it's like, I'm really struggling with depression. So you'll get on medication, but you're not really getting out of it. And that maybe that you're missing the other component to it. So thinking about that. The other thing that I found, and this is really important, is that people tend to, they try an antidepressant and it doesn't fix them right away. And so they stop taking it. So they're like, it doesn't work for me. Well, antidepressants don't work like that. It's 4 to 6 weeks before you even notice if it's going to have any benefit for you. And the other part is the relapse rate is really high because people go off of it too soon. So one, if you decide to go on to it, make sure that you stay on it long term, meaning 9 to 12 months. That's the bare minimum. If you get to 9 to 12 months and your symptoms have gone away, you've really reached remission, you're back to where you want to be. Then you work with your doctor to slowly come off of it. If the symptoms come back, you go back on it. But that's where a lot of people think that antidepressants don't work, is because I tried it and it didn't work fast enough, or I tried it and I went off too soon. So if you're going to do it, go in all the way, because I have worked with people who have been on antidepressant medications off and on over 10 to 12 to 20 years. And they just think they don't work, and we do it the right way. And those same people who were resistant to medications magically get better, and they also get back to the point where they don't need the medications anymore. And then the other rule is that if you go on the medicine and you try to go off of it, the symptoms come back, you want to do another year. And then if you do it again, so 2 or 3 times, if you just really kind of relapse every time you go off the medication, the recommendation is long-term therapy. And that's not that big of a deal to take some medication if you need it. So just briefly, again, going through the biological, the sleep, medications are important, the psychological treatment of how you're talking to yourself. And so it's already been mentioned, but you can look up 10 cognitive distortions on Google. It will pull up 10 of the most common ones. And I found it really helpful for people to just kind of change things. Like if they start catching, oh, there I go again, mind reading, or here I'm overgeneralizing again. It's easier to catch yourself on doing that, because depression tends to lead you towards those negative thinking. And then, as Gary's already mentioned, the social aspect is really important. So making sure that you have ways of connecting with people. And I like to think about it as having maybe 2 separate groups of people. The one that's just the stress relieving group that maybe you don't share your deepest, darkest secrets with, but then having these core people that you can share that with. So if you're just feeling like, I just need to get out, I need to talk to somebody, I need to really let loose and let go, have that one group, but then have the other group where you can go for a car ride or do something that's just a relief from life in general. So those are kind of my basic thoughts as we go forward. I do want to say one thing that a lot of people don't realize. By definition, alcohol is a depressant. People struggling with depression should probably not be using a depressant. So a lot of people they're struggling with depression, they're drinking a lot to try to cope with it, because it is a good coping strategy to numb out your brain temporarily, but it tends to drop you off the other end. And so if you're struggling with depression, maybe you want to cut back or eliminate alcohol. And I've, with a lot of people, you say, let's just cut it out for 4 weeks and see what happens, because sometimes that can be the cure in and of itself. So those are my brief thoughts, and obviously we can only touch briefly on this, but I would encourage you to look back at the handout that we've provided.
Thank you, Dave. I really appreciate that. It's really good information. The last panelist, last but not least, is Anna, and she'll be talking about grief and loss.
Hello, everyone. Oh, look at my picture. I'm just seeing. So, you know, I get the part of the presentation that is often the saddest and the hardest to talk about. And when you think about grief and when you think about loss, you know, especially during this time, this pandemic, we have experienced loss like we have never before, not at least in my lifetime. You know, we all expect that as, you know, people get older and sicker, that passing away is a kind of maturational loss, something that we all know is going to happen eventually. Is you know, we can kind of plan for it. We know that things are going to happen. But this pandemic is completely situational. And that situational loss is something that we were unable to plan for. We were not able, you know, to prepare. I know, just like I'm sure many of you, I came to work one day and they said, pack up everything, don't come back to the office. We don't know when you'll be back. And fast forward, we're a year and some months into not being able to resume life as it is normal. And so again, those kind of maturational and situational losses are handled very, very differently. And I will say that some of the things that really have distinguished this kind of period of grief and loss is that we haven't been able to kind of do our normal process of mourning and having closure with people. We haven't been able to have proper funerals, and we haven't been able to gather together and celebrate the life of our people. And, you know, it is just not a normal situation to turn on the television and see that thousands of people have passed on in one night. It's just not normal. There's no way to normalize what we have experienced at all. And so I'll just quickly go over, I'm sure many people know the stages of grief, and I'll spend the majority of my time talking about ways to cope and manage. But of course, the stage of denial, where we just, you know, I'm just not ready. I am not ready to be at the point of accepting that what has happened is real. Of course, we have anger. And I think a lot of people are afraid of this word anger. They kind of say, oh, no, anger is bad. But anger is a primary emotion. And it is something that we all experience. How we manifest it, how we tend to express it, that's where the concern may come in. But anger is a normal emotion, and you can be very mad. You can be very upset that the loved one has went on, you know, the person who you love the most has left you here, or, you know, those feelings are very normal. So I want to make sure I normalize that for people. And then you have that stage of bargaining where, you know, you say things like, you know, if this can change, I will forever do this, or I will forever do that. And we know that that stage is probably not a very stage that's going to be productive, but it is a process. And again, this grieving and this process of loss is definitely a process with very distinctive stages. And then we've already heard a lot about depression. And, just that overwhelming sadness, that despair, that, it comes with all kinds of symptomatology like lethargy and, crying and just those kind of heights of emotion. And then those are emotions that we can't express, that kind of depression that it kind of like settles in our bones. That's how I kind of explain it to my clients, where you just can't move forward. You're just stuck there. And then we get to the stage eventually of acceptance. Now, I work with a lot of child trauma in a child welfare system. And one of the things I always bring up is because we do a lot of work with our kids around this loss. And one of the kids said to us that I will never accept my situation. It is not something that I'm able to do, but I will reach a point of understanding. And so for me, it's always important to do that very distinct kind of difference. When you talk about accepting something, people feel like you've internalized it, to just understanding that this has happened. This is definitely a loss for me. And I understand that it has occurred. And I can just give you that, my understanding. Now, ways to really deal with this kind of grief and loss that we experience. First of all, is to acknowledge the feelings and emotions. I think sometimes we try to rush people through the process of grief. We cannot determine how long it's going to take a person to grieve. People have developmental grieving, meaning they bounce back and forth in between those grieving stages. We can be triggered back to grief by a song, a smell, something someone told us. Really, grief is individualized and we all experience it. But the good thing is that we should allow ourselves that opportunity and that time to grieve and process. And so not suppressing our feelings or emotions, crying when we need to cry. I tell my clients all the time, if you don't want to be the person that say, oh, you're crying all the time, allow yourself 10 to 15 minutes and go at it. Have that moment of just letting it all go and then finding a way to bring yourself back to calm. But the good thing is never repress, always feel those emotions. And also think of ways sometimes to fill up that void, right? I don't know, for different people it's different things, meaning you may have a creative outlet. You may want to pick up something that gives you an opportunity to express your feelings on a canvas or in music or, writing in a journal, doing poetry, something to help fill that void and that loss that you're experiencing. Also, if you can put the emotion aside for a moment to learn from that grieving process, meaning I lost someone, I need to really reach out to everybody I care about and love. I need to, call everybody, check in. If you can learn something from that process, please try to do that as well. And we've heard this several times. All of the panelists before me have talked about CBT, which is something that I practice all the time with my clients. And it's so important to replace some of those negative thoughts with positive thoughts. And it sounds really easy, but it's not always easy to do. And so I encourage my clients to write down affirmations, write down gratitude statements, really repeat those things to yourself. I call it positive self-talk, where you just sit around and you say positive things about yourself or others, and you really fill your time with those kind of efforts to move your mood from one state to another state by using that type of practice. Also, position yourself to move forward, meaning, and I think right before me, Dave talked about how depression lasts for such a long period of time. That's when you need to see somebody. I encourage everybody, right, to see somebody. This is not a bad thing to really address your mental health. This is not a negative thing to want to have someone to talk to process, to share, to get techniques and strategies for you to be able to cope. This is absolutely the time to reach out to a professional, especially now. This pandemic has really presented loss to us in a very real way. And so if we don't have those coping strategies, there is always help. You can reach a therapist by phone, by text, by computer. You don't even have to leave your house. So, it is the time to do that. So any questions? We're here.
Thank you so much. All four of you provided really excellent information and such a good overview to us. At this point, we're going to transition to the questions that were asked of the community members during the registration process. So we've divided the questions we received among the panelists, and I will direct a question to each of you so that you can respond. So the first question goes to Dave. How do you know if you are just sad or if it's depression? And how do you know the right time to seek a mental health professional?
Great. So I addressed it a little bit already in that, so when it becomes this pattern of 2 weeks where more days than not, you're really struggling, either feeling down, depressed, or hopeless, or you've just lost interest in things. Sometimes people just don't realize that they have depression because they don't feel all that sad, but they just don't. They used to garden. They don't like to garden anymore. They used to play video games. They don't play video games. They've just given up on things that they used to like to do. And I would echo what Anna just said. Get help sooner rather than later. Our jobs as therapists are so much easier if you come in sooner. And so when it comes to depression, if you've been slogging through depression for a couple of weeks, and now it's 3 weeks, and now it's 3 months, now it's 6 months, people wait too long. The single number one indicator of people having a depressive episode is having a previous depressive episode. And so if we can get a hold of it sooner, treat it effectively, as we've talked about, and get it behind us, that's the best outcome. And Juliana could talk more about this in her expertise, but there's a pretty clear indication that depression is a toxic brain syndrome where your brain doesn't like to live in depression. And so the longer we're in it, the more problems that you have. And so really get help, get it soon, get it easy. And if you find out, you go in, it's like, hey, it's not depression, let's help you cope with it. And you go for a few sessions and you're done. Are you out anything? No, I don't think so. So get help sooner rather than later.
Great. Does any of do any of the other panelists have anything to add?
I just want to say real quickly that in kids, the symptoms are different. So in adults, you really need to have, the depressed mood and anhedonia, the loss of interest in activities. Kids, you really don't need that. You can have high levels of irritability. So oftentimes people don't realize that their kids are depressed until I bring them in and I do some evaluation work and I say, your child is depressed. What they really think their child has is a behavior problem. So just be aware that, if your kid's really crabby, they're getting sick crabby and they're like that all the time, that could be depression, and just be aware of that.
Thank you. The next question is for Gary. When someone mentions suicide, how can I be helpful and not cause any harm?
Yeah, it's a really good question. I just took a lot of training around suicide, and so it's very much on my mind right now, and certainly have been through it with clients over the years. I think the first thing to do is to offer support and just to be there for them, to listen. The greatest way that we can honor another human being is to listen, and actually listen and be present with them. That's the best way to honor someone, and to listen without judgment. Listen without telling them what to do or what they have to do. Remind the other person that you really care about them. I love you, I support you, I care about you, I'm here for you. And I think someone who has reached that point is often feeling unloved and alone. So I'm here for you, I want to help you. And then help is available. And then say to them, there's a lot of help. There's mental health professionals, there's ways for you to get help. I'd like to help you to get help. I'd like to be there with you to help you to get help. I'll get on the phone with you. I'll get on the web with you. I'll go to the first session with you if you want to, but there's help. You are important. You are loved. You are supported, and I'm here for you.
Thank you. Does anyone have anything they want to add to that answer?
I would just I love what Gary said. The other thing that is really important with this is that you don't make somebody suicidal by asking, but you may miss out on an opportunity if you don't ask. So if somebody's really struggling, you probably just want to ask them, have you had any thoughts of hurting yourself? And if so, will you let me know before you do anything, and let's get you help. So asking people does not cause suicide. Not asking can it result in suicide.
Thank you. The next question is for Anna. What are the best coping mechanisms for teens, and are these different from what could be used for adults?
So that's a very good question. I think that when it comes to teens and adults, some of these mechanisms are exactly the same. But I think you have to remember it's not about the age of the child, it's about their developmental level of functioning. We have some kids who are 15 who act like they're 10, right? And some kids who are 10 who act like they're 16 or 17. So it's very important that you speak to a child or a teen in their developmental age range, right? And again, sometimes, you know, we as adults have a tone when we talk to teens or a tone when we talk to children. It's important that we kind of remove that we kind of speak the language that they speak. And that we kind of address some of these strategies for coping in ways that would be beneficial to them. For example, you know, for an adult, I may say, well, you know, in order to handle stress, maybe you should talk to another adult. For a teen, I may say, is there anybody that you want to talk to that you trust? So I wouldn't so much as tell them where to go or who to speak to. Also, there are so many creative outlets for our teens. Talk therapy for our teens is not always my first go-to because a lot of times they have a very hard time trusting adults and sharing everything with adults without feeling judged or criticized. And so, you know, we have dance therapy, we have art therapy, we do all kinds of creative therapies with our teens that I work with in child and family, but not necessarily talk therapy. So I want people to really open up their kind of mind view about that. Art therapy is excellent for teens, being able to, you know, include them in activities of cooking or, you know, things that they love to do. But while they're doing that, that's your opportunity to start talking, to get them to trust you more, to kind of break down those barriers of like shame or guilt and really start to talk to them about what their needs are so that those needs can be tailored, those coping mechanisms and strategies can be tailored specifically to what they need. Again, some of the same things work with adults, but for teens, we just have to remember where they are developmentally and really utilize the things that they're interested in to kind of build that trusting relationship, to find out what their needs are so that we can really curtail those coping mechanisms to meet their need.
Great. Any other additions to Anna's answer? Okay. Juliana, how do I speak to a child who is struggling in school? He has lost motivation to do many things.
That is such a great question. And I think, unfortunately, a lot of kids are there right now just because of how his school has been. It's been less than ideal if you're virtual or in person or homeschooling or anything, and no one has gotten exactly what they need out of school this year, I think it's fair to say. But assuming that the environment is, you know, as part of it is going to be changing the environment. Hopefully things will get somewhat better next year. But assuming this was a pre-existing condition, what I can say is that about motivation, I really believe that humans and especially kids are just naturally intrinsically motivated to learn. They might not be as interested in every single topic. They might have natural facility or talent for every single thing. But in general, kids want to progress. They want to keep up with their peers. They want to feel like they're growing and progressing and learning. And so when someone tells me their child's unmotivated, what I think is there's something in that child's way. And it's my job to figure out what that is. So, in the case of motivation, so motivation is, according to psychology, it's a combination of two things. Number one, you've got to believe that you are capable of doing it, and you have to believe that the thing that you're being asked to do has value. So for most kids, the second one isn't the situation, okay? They probably are not engaging in activities that they believe have zero value, although there may be. They may just be like, I don't want to do math. I don't want to do swim team, whatever it is, you know, that they have to engage in. So it could be that they just don't value the thing that they're doing. But oftentimes what the real problem is they believe that they can't do it. And so there's something getting in their way. And so it could be learning wise, it could be attention wise, it could be emotional. And so I think it's really important to kind of dig down and figure out where is the problem with the motivation coming from? What is the belief that is inhibiting that motivation? So a book that I really love just in terms of how to find out what your kids are thinking and how to have really good communication with them is a book called How to Talk So Kids Will Listen and Listen So Kids Will Talk. There's a teen version as well. And it's really about what Dave was saying. It was about doing really good listening, not jumping in, not jumping to conclusions, but listening to what your child is telling you and asking questions that are open-minded and non-judgmental. So, you know, you might find out, you know, there's a kid, for example, who is having a terrible time in school, and he might say, well, why don't you want to do your homework? And they might say, it's too much. It's too much what? It's too much writing. And you find out that the kid, so you might take the child for an evaluation, find out the child has some fine motor delays, and then you might come up with solutions based on that. Or even you don't have to do the evaluation. Maybe you come up with solutions anyway. What if I write it for you? What if, you know, what if we do it, instead of drawing it, if we do it with, you know, manipulatives, you know, for the math and try it that way. You know, you find ways to work around it because kids can't always articulate, hey, I see a problem in front of me and here's my solution that I've planned for it. That's not how kids work. They see a problem in front of them and they don't have the life experience or the executive functioning skills to work their way around it. That's our job as adults. So that's a little bit about motivation, and I hope that you can figure out what's going on with your child and make it better.
Thank you. Anything to add? Okay, we're running out of time. So there's 4 questions left, and then hopefully we can do a couple from the chat. Dave, how does infusing and not being able to hit a vein filter into depression and feelings of failure?
Well, I've been there. I have 2 boys with hemophilia, and my record was 10 sticks before we got a vein. So, and I've never been the kids have never let me forget that. But I think that's part of the problem with anything with failure. And I think there's a lot of failure going on. People who've lost their jobs, people who are, you know, has a kid that's not doing what they think they should be doing. Being not able to treat yourself or your child because you're not doing a very good job. But part of the thing when it comes to performance is sometimes we just need to take a break and calm ourselves down. And that 2-minute break can actually make a difference for us. And so I think that performance anxiety really gets in the way a lot of times when you're trying to perform something, especially when it's involved with yourself or your child about medical treatment that they need to get in their veins as soon as possible. That anxiety just has to play a role in that. And I think the biggest thing here is to practice relaxation so that you can use it when you need it. That's one of the big things I find with dealing with anxiety is that if you haven't practiced breathing or reducing your anxiety, you're really going to have a hard time when you really need it. And so I would say practicing, relaxation strategies that work well for you, practicing them numerous times throughout the day, all the time. And then when you need it, when that infusion has to be done, you can calm yourself down, and then you'll be more likely to be successful in doing it.
Great suggestion. Any other thoughts? Okay. Gary, a lot of folks in the community have survivor's guilt. What recommendations or resources can you share for those who feel this way?
Yeah, that's a really good question, and I deal with this in so many ways with clients who, over the years, either are caregivers or they have a chronic condition like HIV where they've seen people die over the years and they were able to get the medication that's helped them. I see a lot of survivor guilt. You know, I think, you know, what I always talk about, you know, life is random, and you know, we don't know why things happen, and it's kind of a spiritual discussion in a way. We don't know why bad things happen and why they happen to other people and not us. And you know, I think a way to deal with survivor guilt is to be kind and compassionate and to give, you know, to give to others and to be grateful, and in that gratitude express it in terms of how can I show kindness to someone else as a survivor. And you know, I think that, you know, and you know, guilt is kind of a useless emotion. You know, it keeps us on the straight and narrow, it keeps us from doing bad things. But beyond that, the fear of guilt, but beyond that, it's kind of a useless emotion. And I think what's important is to embrace your life and embrace opportunities to show kindness to others. I think that's really what it comes down to.
Thank you. Any other things anyone wants to add to that one? Okay. Juliana, this one is for you. I am feeling stuck, overwhelmed. How do I get unstuck?
I would start by taking a deep breath. Okay. And maybe, first of all, recognize that being stuck is a normal part of change. So your brain might just be a bit resistant to the idea of what the change is that you need to be, that you want to or need to be making. So it is okay to feel stuck sometimes. It's okay to feel a little bit hopeless sometimes. You want to reach out to your support network. You want to acknowledge what the feelings are that you're having. And, you know, you also want to recognize that you cannot be brave without being scared. They're part of the same thing. So courage comes from being vulnerable, from making that change. So if you are feeling stuck, then you might need to just call upon yourself to find that courage and bravery within and muster the resources surrounding you to say, okay, well, this is how I can engage in that. It's hard for me to answer more without some specifics. But we all feel stuck sometimes. We really do. And sometimes you have to let yourself feel those feelings, whatever they might be. So you might be stuck because you haven't let yourself experience the negative emotions. You haven't let yourself feel sad. You haven't let yourself feel angry. You haven't let yourself feel scared. You might need to spend some time feeling that before your brain and body are ready to move on, if that makes sense.
Thank you. Anna, we got this question in a couple of different varieties, but this is basically the question. What recommendations do you have for local member organizations who are looking to support mental health efforts in their own communities?
A very good question. I really think, again, we're very lucky to have, you know, this community who is so willing to participate in these kind of activities. And so I think the first thing is to really have that community involvement and really listen to them about what is needed in their community. I also think that, you know, mental health generally has been a topic that is not a real easy topic to discuss. When I first, you know, started talking about it with HFA, I know it's a topic that, again, I think for a long time wasn't the focus point. And I think for right now it is. And therefore, we really need to be able to have the resources available for the community, have people that they can actually reach out to, provide all the necessary connections in their own personal communities as well, just to address the varied needs, because again, mental health encompasses so much. It's not just one thing. There's that anxiety, that stress, there's panic, which is different than anxiety. There's, all kinds of grief and loss and, just a lot of things that are involved. But I do believe, and what you see here is that you have a whole variety of professionals who have the expertise to really work within the community and provide them just what they need. So, if you are a community member, I would say really, find your voice. Tell us exactly what you need, and I'm sure that those needs can be met. There are definitely so many programs that you can access, and again, this world of technology is absolutely amazing right now, ever changing, and so there are so many things that you can reach out to, and so many people that you can reach out to in order to get some assistance and really to provide the programming and the things that the communities are really asking for.
Great. Thank you. This one is for Dave. How can you tell a friend that they are spiraling down?
Very carefully. But I think Gary has said it the best so far from what we've talked about. Some of this is to just go up to them and say, I'm concerned. What's going on? Can we go get coffee? Can we go to lunch? I'd really like to spend some time with you because I'm worried about what's happening with you. And I find it, I talked about those two groups, the one that you're just going to get out and do fun things with just to feel better. And then the other group that you can really talk about hard things. You need to be that person that can talk about those hard things with them. And I found, maybe they'll get a little bit offended, but if it comes from a sense of care and concern, I just don't find people get offended by that. And so it's better to just bring it up, say, offer to do something. Can I come over? Can we talk? Can we go for a walk? Whatever that works for you and that friend, but to bring it up and then you don't have any concerns. Very rarely are you going to lose a friend because you're concerned about them, and that's all you're doing.
Great. Anything else to add to that one? Okay. It looks like some of the questions were answered in the chat, and unfortunately we are rapidly running out of time. It's almost the top of the hour. We did put into the chat the resources that were mentioned before. I also wanted to say that although HFA is not a direct provider of mental health resources, there are extensive resources on the website and available online. This recording will become available online in the next couple of weeks. And in addition to that, as part of HFA's commitment to mental health, we are going to offer 4 trainings in mental health first aid in 2021. The first one of those trainings will happen in April. The mental health first aid training is not intended to give you any sort of training as a therapist. It's really an ability to be able to listen non-judgmentally and assess people and connect them to resources. But it's a great way for people across the country to be able to provide support within the bleeding disorder community and without, and to be able to feel like they have some skills in order to accomplish that. So please stay tuned for more information about that. And as I mentioned at the top of this webinar, Dave and Anna and Gary and Juliana are frequent speakers for HFA. So if you are interested in hearing more from them, I would encourage you to talk to your member organization staff or to anyone at HFA directly, because I think, as we've all pointed out, this is certainly a very critical topic that we will continue to be providing additional resources for. So if there are aspects of mental health that were not covered tonight that you'd like to hear more about, please get in touch with us so that we can continue to be a resource and support to the community. And last but not least, I would like to give a huge thank you to all the panelists for your time and your expertise and your empathy and just sharing so much with HFA and for the whole community. It's been really wonderful to work with you and also to be able to benefit from all of your wisdom. So thank you.
Thank you.
Thank you.
And with that, we're out. Thank you.
Heather.
Bye, everybody. Thank you.
Thanks.
Bye, everyone. Thank you.